Our next session is going to be complementary. So we're not talking just about international financing from a concessional loan perspective, but equally important are the role of philanthropists. So this next session is going to be a live virtual broadcast with Q&A with Chris Elias, who I think needs little introduction, but he's the President of Global Development Division at the World Bank. And I'd really like to acknowledge the Foundation's support to this event. And to a lot of the work that's been happening across Asia and Africa to support work in early detection with respects to pathogen genomics, including for our work here at Duke-NUS. So Chris is coming to us live. I guess the time difference is he's in Seattle right now, but look forward to his input and comments on catalytic philanthropy and pandemic preparedness. So over to you, Chris.
Thanks, Paul. It's good to see you. And I am at the Bill and Melinda Gates Foundation here in Seattle, not at the World Bank. And it's still November 4th here. So I'm actually with you yesterday in Singapore, but I think we'll find a way to make that work. And I'm really sorry that I couldn't be there with you in person. One Health is an increasingly important concept in our understanding of modern pandemics, as you've been talking about all week. And it's a concept that is still in many ways defining itself. And that makes this Congress an important opportunity for advancing and clarifying our understandings of just what One Health is and what it can be. The fact that this is the first World One Health Congress to be held in Asia makes this event especially meaningful for all kinds of reasons. Not only because Asia was the original epicenter of COVID-19, but because so much vital thought and action concerning humanity's shared future is taking place there in the Asia-Pacific region. So it's an ideal time and place to be looking seriously at how to define the One Health concept for an age of heightened pandemic risk, as you heard from the previous speaker. I realize that one common criticism of that concept is that it's simply too broad, that almost anything can be seen through a One Health lens. But I think, and we as a foundation think, that there's real value and relevance to the One Health framework. It offers a usefully holistic perspective on infectious diseases, their emergence, and their detection, and it compels us to pay attention to causal factors that might otherwise be discounted or ignored. And I thought Manuela did a very nice job of laying those out. In our own internal discussions here at the Gates Foundation over the past decade, the importance of a strong One Health approach for pandemic prevention, preparedness, and response has become increasingly obvious even before COVID. We were already looking more closely at issues related to infectious disease surveillance, as well as to issues related to livestock health and productivity as part of our agricultural development strategy. In his book, How to Prevent the Next Pandemic, which was just released this past May, Bill Gates made a point of including some stark references to the role of the animal-human interface in the spread of infectious disease. Quote, in the past 50 years, according to the World Health Organization, scientists have identified more than 1,500 new pathogens. Most of them began in animals and spread to humans. Out of the 30 most recent unexpected outbreaks, 3/4 have involved animals other than humans. And the odds of a pandemic that a pandemic will strike are only going up, partly because humans are invading natural habitats at a growing rate, interacting with animals more often, creating more opportunities for a disease to jump from them to us. End quote. As these remarks might suggest, the Foundation will continue to bring a very open mind to the role of zoonotic pathogens in our work on pandemic preparedness. And what I'd like to do today is not to necessarily provide a definition of One Health per se, you've been talking about that all week, but rather to encourage all of us to look at the role of catalytic philanthropy in pandemic preparedness, and in doing so, perhaps advance the conversation on what a One Health approach can look like in practice. So first, perhaps a shorthand definition of catalytic philanthropy may be in order. It's a phrase that we and our partners have been using for quite a while now, and we by no means have a monopoly on it. Way back in 2012, Bill wrote that, quote, when you come to the end of the innovations that business and government are willing to invest in, you still find a vast, unexplored space of innovation where the returns can be fantastic. This space is a fertile area for what we call catalytic philanthropy. And he went on to say that, this kind of philanthropy, quote, the investor doesn't need a share of the benefits. Those go to poor people or sick people or society generally, all of whom stand to gain earth-shaking returns from the kind of innovations that business and government likely won't pursue unless philanthropy goes first or partners with them. And once we've found a solution that works, catalytic philanthropy can help to harness the political and market forces to get those innovations to the people who need them the most. So there's a sense of how philanthropy can carry out certain roles, make certain investments that governments and the business sector can't, at least, or won't, at least on their own. And I'd like to talk about 3 of these distinct roles that catalytic philanthropy can play in pandemic preparedness. All 3 are pretty well known, but for reasons I'll explain, I think they each take on new layers of relevance when applied to the One Health context. The first is the ability of catalytic philanthropy to place bets, to advance ideas that for whatever reason, the business sector or the government sector cannot or will not. At the Foundation, this is what we do to catalyze change in traditionally underfunded disease areas. The second is the ability to build creative public-private partnerships in a responsive and flexible way, especially in settings where such an infusion of resources can have an outsized positive impact. And the third is to engage in forward-leaning advocacy for new systems and strategies that can really push the boundaries of what's achievable in pandemic preparedness and response. Again, this includes actions that governments and corporations either can't or won't take, at least not on their own. So let's start with the first unique role of catalytic philanthropy in pandemic prevention, placing bets that others can't or won't. At the Bill and Melinda Gates Foundation, we believe that if we want to prevent the next pandemic, we need fairness across the entire health system. People in poorer countries deserve the same basic levels of care that people in wealthier ones have. They deserve the same access to life-saving tools like vaccines and therapeutics. That's basic health equity. And equity has a very direct relevance to pandemic preparedness. Infectious disease outbreaks begin and end in communities, and they can often be stopped by early detection and response before they become pandemics. The methods and tools needed to prevent, detect, and respond to emergent pathogens are the same everywhere. And it's in the self-interest of high-income countries to ensure their equitable access. The problem is that the very entities that might seem best positioned to make those methods and tools available often can't or won't do so. Governments, especially in the countries of highest need, often lack the material resources, institutional capacity, or political will. The business sector often lacks a market incentive. And again, that's a problem that tends to come up most frequently in those countries where the need is the greatest. This represents a gap that catalytic philanthropy can help to fill. We've seen this over the last couple of decades with organizations like the Gavi Vaccine Alliance, the Global Financing Facility for Women's and Children's Health at the World Bank, and the Global Fund to fight AIDS, tuberculosis, and malaria. All of those mechanisms came into play in responding to the COVID-19 pandemic. These and similar entities operate from outside of the traditional definitions of government or business, and they're therefore free of some of the material or jurisdictional or attitudinal constraints that sometimes stymie action. The Gates Foundation, in its support of these and other diverse partners, is itself an example of that phenomenon. We know we have a certain freedom to place bets on methods and technologies that corporate and government actors might see as too risky or uncertain, and we can continue to use that freedom to fight pandemics and to save lives. One of the areas that the Gates Foundation believes is especially important in pandemic prevention is making and delivering better tools. As Bill Gates wrote in his book, quote, "Ideas for new tools must often be nurtured and researched, sometimes for decades, before they produce anything of practical value." Again, that's not going to be an especially compelling concept for a lot of government agencies or for-profit corporations. But it's exactly where catalytic philanthropy can help to make a huge difference, whether it's in advancing vaccines like the mRNA technologies that have proved so useful for COVID, or in therapeutics, or in diagnostics to spot potential emergent infectious diseases. Another hugely important example is disease surveillance. Investing in strong genomic surveillance is a bet that others won't likely undertake on their own, and it's crucial to advancing the One Health framework for pandemic preparedness and response. In fact, as you mentioned, we've recently issued a grant to the sponsor of this year's Congress at Duke-NUS to help establish the Asia Pathogen Genomics Institute, which will collect information on genomics surveillance for pandemic preparedness across 5 nations. We've also similarly supported an African Pathogen Genomics Institute through the African CDC. This is just one example of non-governmental, non-corporate entities taking advantage of their unique ability to place some of those big, bold bets that others can't or won't. And it relates very directly to the One Health framework, which in years to come is going to call for vaccines, therapeutics, diagnostics, and surveillance approaches such as wastewater surveillance that may seem somewhat speculative at the outset, but may prove life-saving as new zoonotic conditions emerge into human health threats. What we do know for sure is that this work can't be done in silos. Indeed, the diversity of perspectives, experience, and expertise in your audience alone is a testament to that. So the second role that catalytic philanthropy can play in fighting pandemics is to leverage the collective strengths of the global health architecture by way of building creative public-private partnerships. And I'll share just one example. Building on the lessons learned from the Ebola outbreak in 2014, we joined together with other philanthropies and governments to found CEPI, the Coalition for Epidemic Preparedness Innovations, back in 2017. We knew that another serious regional outbreak or even pandemic would happen, and that we needed a better system to detect, respond to, and prevent the next outbreak. With the right investments and commitment through creative partnerships, we could build a stronger pandemic-ready R&D ecosystem that would be ready to better respond to the next new outbreak. The Gates Foundation was primarily interested in funding vaccine platforms so that these innovations could be used to develop vaccines for future pandemic and epidemic threats. And the benefits of the R&D could then also accrue to poverty-related neglected diseases. Initially, the CEPI approach was based on a just-in-case philosophy. In other words, developing those platforms just in case a particular pathogen, some of the ones that we knew about, broke out and threatened to spread. And then COVID hit. CEPI responded very quickly and was one of the first global public sector body to invest in mRNA COVID-19 vaccines. Indeed, on January 23rd, 2020, when there were just 581 confirmed cases of COVID-19 globally, CEPI announced its first COVID-19 vaccine partnerships. CEPI made early investments in the Oxford, AstraZeneca, and Moderna vaccines, and both of those are now saving lives around the world. And in addition to serving as the COVID-19 vaccine R&D connector for much of the global health, the global response network, CEPI's also leading efforts to expand the world's capacity to manufacture COVID-19 vaccines. It's a co-lead of the vaccines pillar of the Access to COVID Tools Accelerator, or ACT-A, which is a collaborative effort to speed up the development, production, and equitable distribution of tools for the COVID response. The pandemic has made it clear that we need organizations that are fast and nimble, and that have a global focus that complements national efforts. And that's exactly the role that CEPI was designed to play. Central to their approach is the principle that making vaccines available to those who need them most is the fastest way to bring the pandemic to an end, a pandemic to an end. In other words, they complement just in case now with just in time, because it's clear that speed is an essential factor in saving lives, particularly at a time when climate change and shifting human population patterns are creating circumstances very favorable to the emergence and spread of novel pathogens. Traditionally, the development of new vaccines, including testing and deployment, can often take more than 10 years. The COVID pandemic has shown us that the world must be ready to produce safe, effective vaccines much quicker than that. So CEPI has an ambitious target to develop and deploy effective vaccines within 100 days of a pathogen being sequenced. And that could help to make epidemics and pandemics much less of a problem in the future and potentially save millions of lives. That's why CEPI's 5-year plan, which has equitable access at its heart, is a critical step in reducing the risk of future pandemics and epidemics. Yet even as we talk about the unique role of catalytic philanthropies, we need to bear in mind that these organizations are by no means acting on their own. In fact, CEPI's largest funders are actually governments. It's the partnership that's the essential element of these creative collaborations. My third point about engaging in forward-leaning advocacy to create durable and more robust pandemic preparedness and response mechanisms. The best way to introduce this last point may be to start with the Global Preparedness Monitoring Board, or the GPMB. If you go to the front page of its website, it says it right there. The GPMB was established in 2018 as a high-level platform for political advocacy. The Gates Foundation, together with the Wellcome Trust, were early supporters of the GPMB Secretariat at the WHO, and I've been honored to serve as a member of the GPMB since its inception. And I'm a big believer in the unique importance of this advocacy mission in the pandemic preparedness and response. The GPMB had a major voice in advocating for a sustainable financing mechanism to support the gaps that were identified from some of the JEE exercises following Ebola, the gaps in pandemic preparedness and response. That included sounding the alarm in their first report in September 2019, even before COVID, about the need for sustainable PPR financing. GPMB's advocacy work has helped with many others to contribute to this exciting new initiative of the G20 that you heard about from the World Bank, the Financial Intermediary Fund for Pandemic Preparedness and Response, or the FIF for short. This venture, hosted by the World Bank, involves a very broad and diverse range of partners, including other catalytic philanthropies like the Wellcome Trust and the Rockefeller Foundation. It was launched in September, and a lot of the early discussion in that board over the last couple of months about the FIF's priorities involved the One Health concept, and in particular, the need for a strongly integrated disease surveillance capacity, one that includes a very clear awareness of the particular importance of surveillance related to the animal-human interface. A more formal launch of that fund will take place this weekend at the G20 in Indonesia, and there's a specific working group now working on putting together the first call for proposals, as Manuela said, will come out in the next couple of months. So in closing, I'd like to offer just a few summary points. I know I'm not the first to say it, but we've all learned that in a very real and difficult way that pandemic prevention efforts are not optional. Indeed, they're vital to the overarching goal of health equity worldwide. And One Health is a framework that must contribute very significantly to the design of those efforts. So when we're looking at the role of catalytic philanthropy in advancing pandemic prevention and preparedness objectives, I think it's valuable to look at these three unique capabilities. One, the advancement of bets that no other major ecosystem partner is in a position to undertake. Two, the development of creative public-private partnerships to address these gaps in pandemic preparedness and response. And finally, the advocacy for a more robust and durable pandemic prevention, preparedness, and response architecture that is sustainably financed. Thank you for your time and for your engagement on these increasingly vital issues, and I look forward to a good exchange of ideas at the Congress and in the future. Thank you.